My name's Joey. I'm the prep coordinator and peer advocate here at UCSF 360. We're the HIV clinic at UCSF Parnassus. We're really the HIV clinic for the whole UCSF system. We've been around since 1984, and so I have one foot in both doors. Half the week, or a lot of the week, I help out folks who are HIV positive to get in care, stay in care, and do well. And the other part, I'm helping with our prep program. So that's outreach, marketing, counseling patients, helping them navigate insurance and appointments and all that stuff. UCSF 360 Wellness Center is our new name. We just rebranded. It's exciting. New website, check it out. And we serve about 1,000 people here in San Francisco. Most of them are living with HIV, but we also have a prep clinic. We have a really diverse patient population, just about every demographic category you can imagine. We have patients that represent that or some combination of those. Well, it's sometimes it's kind of like a jigsaw puzzle. Like you put this piece in place, which is, maybe one of the existing coverages they have, and then, okay, well, your income is sort of this, and so you're eligible for this, and that's going to complete the picture to get them the coverage that they need. Or maybe you're not eligible for this, but you are eligible for this. Sometimes we have to go to bat for somebody and call their insurance company and not argue with them, but have them check it again, or call the drug manufacturer and have them appeal a decision. But the good news is that this year some of the programs have become a little bit more generous and have made their restrictions a little bit more flexible. So it's actually easier than ever to get coverage for PrEP, whether they get it through us or someone else. It's kind of a buzzword these days, navigation. I think we used to call it outreach or case management. It sort of combines a lot of skills and techniques from a lot of different areas. But the idea really is that concept of navigation. I think a lot of patients, a lot of consumers experience healthcare as this kind of maze where your insurer is denying you, or this jargon, deductibles, out-of-pocket co-insurance, co-payment. You're waiting for an appointment, maybe. You have to deal with the pharmacy sometimes. It can be really overwhelming for people. It's not like, in old movies where the doctor comes over and hands you something. It's complicated these days. And so we're helping patients from A to Z, from before they get in the door, figuring out whether PrEP is right for them, whether they want to take the step of coming in to meet with us and talk about it, to getting an appointment, again, getting the coverage like we talked about, making sure they can get to the pharmacy and pick up the drug, making sure that they're not having side effects, or if they are, that we know about it and we're helping manage them, that they're staying on that drug as long as they need it, and following up with us to make sure it's safe for them. So it's the whole journey. A couple pieces. I think the first is work together. So hopefully if you're a PrEP navigator, you're in an area where maybe there's at least one other PrEP navigator. Maybe there's 100 because you're in San Francisco, and maybe there's 3. But if you work together, you can, first of all, solve problems when they come up. I'm having this issue with this pharmacy, what's your experience been? But you can also refer patients to each other. Insurance changes all the time. This patient's no longer eligible to come to your clinic, but you can keep them in care by sending them to this other person's clinic. You can also get support, so work together. I'm actually really happy to say that today in San Francisco, we sort of launched our own HIV PrEP Navigators working group, and we're going to be doing a lot of that here. My second piece of advice is to know your pharmacist. We've had a lot of success with working with pharmacists at a number of pharmacies here in the city when we've had issues with insurance or with any kind of issue related to access to medication. The pharmacists have been really helpful to find out what's going on. Sometimes they know the insurance better than we do. Sometimes they'll even advance a patient a little bit of a supply to cover a gap in coverage or something like that. So that's been really, really helpful for us. Well, one of my dreams for PrEP is already something that a lot of other people are working on, which is making PrEP available in other forms, right? So right now we have a pill, but people are working on all sorts of other kinds of PrEP, like lube that has antiretroviral agents in it, an injection that you get maybe every month or every 3 months that works as PrEP. They're looking at a ring here in San Francisco and at other sites for people with vaginas that contains both a birth control method and PrEP. So I'm excited about a lot of different forms of PrEP for people who have different needs and preferences. I'm also excited for PrEP to become more normal and more routine and easier. And so something we're looking at in this clinic is a way to do PrEP follow-up over I guess they call it telemedicine, but we probably call it Skype or iChat or something, right? So you go to your lab, you talk to your doctor on your smartphone, and maybe you don't actually need to come in for your visit if all your labs look good. And I think that'll make it a lot easier for people to fit into their lives, while also remaining flexible enough so that if you have someone who actually needs the extra support of coming into the clinic or has other medical needs that they want to get addressed, they can come in, see a doctor, have that checked out, meet with a social worker, see a specialist, see a psychiatrist.